Welcome back. Today we are keeping an eye on your health. I've got Dr. Bose, and today we're talking about burns. There's different kinds of burns.
Many different kinds of burns, and we're talking about this because we're seeing a lot more of this in the emergency room, and it's a common household injury, especially in children. So we need to look out for this, protect our children out there. Amount of damage from a burn directly correlates to how deep that burn is going. So let's talk about a first-degree burn. You guys probably know this out there if you're not wearing your sunscreen. So burns can be caused by the sun, by heat. Most of these first-degree burns are just red, where you look like a lobster, and swelling and pain, and many of us know what that feels like out there. And you can usually treat a first-degree minor burn by yourself at home.
Aloe vera.
Yeah, different things like that. And we'll talk about some of the treatments.
Okay.
And then there's the second-degree burn as we're going deeper. And the characteristic of a second-degree burn is that you have blisters. So once you start getting that blister, you've gone a little deeper, you've gone into that dermis, that second layer of skin, and you're going to have more pain and, you know, that wet kind of appearance you get with that blister. And then if you go deeper into the dermis, it's a third-degree burn. And the third-degree burn, if you have a third-degree burn, it's going to look dry, leathery. It's not that wet appearance. And if you're watching this segment, or you're watching a rerun of it on you know, our social media page or something like that, and you think you have a third-degree burn, you can turn off this video and go to the emergency department.
Yeah, you probably should not be watching TV if you have a third-degree burn.
Third to fourth degree, you're getting into the muscle and deeper areas.
Okay.
So let's talk about the treatment.
Yes.
First of all, there's going to be pain. So to treat that pain, you can use things like just Tylenol or, you know, ibuprofen, and you can use these antibiotic ointments. And the first thing you should probably do is put that burn under cool water. Okay. And probably for a couple of minutes, just get that relief. Then use the pain meds. You can use the antibiotic ointment, cover it with some form of a Band-Aid or dressing if it's bigger, and that might do the trick right there. You may be able to prevent that trick.
When do you need to make the call, okay, I can't treat this at home, when do I need to go to the hospital? So
we talked about the second degree where it's blistered. You could probably still treat that the same way. If the blisters are really large, they may need to be opened up. The small blisters, we leave them alone, because that blister is nature's Band-Aid. If you pop that blister, you have the exposed elements, you have a higher chance of infection. So in summary, we've talked about burns, you know, first degree, second degree, third degree. First and second we can treat, and we're trying to prevent those. And third and fourth degree, go to the emergency room.
Absolutely.
But let's try to prevent this in the first place. So we're seeing a lot of this in the emergency room.
You're already busy enough as it is. You don't need any more people coming in.
Yeah, we don't need those preventable injuries.
All right, very good, Dr. Bose. Thank you so much.